Hello everybody, I am Dr. 𝐂𝐿𝐵𝐿 from the Department of Neurology. Today I am here to discuss about Alzheimer's disease, as September 21st every year is being celebrated as World Alzheimer's Day. Alzheimer's disease was discovered by German psychiatrist named Alois Alzheimer in the year 1906 in a woman. According to the survey which is being conducted globally, the Alzheimer's disease is more prevalent among the Western countries, especially the United States of America. Across the world, about 5.7 million people in the US being affected by Alzheimer's disease in the year 2018, which is about 70% of dementia was being seen among the Western countries, especially the United States. The prevalence of Alzheimer's disease increases with age, which about 3% of population is being affected between the age group of 65 to 74, whereas it increases to almost 32% as the age increases to 85 and above. The prevalence of Alzheimer's disease is much more among the females when compared to males. The risk factors associated with Alzheimer's disease are diabetes, hypertension, smoking, cerebrovascular accident, obesity, reduced sleep, as well as head injury. There are some protective factors associated with the Alzheimer's disease, which include education usually decreases the risk of development of Alzheimer's disease, and good amount of saturated and transsaturated fatty acids also reduces the risk of development of Alzheimer's disease, and good amount of exercise and increased activities across the day also plays an important role in protecting the people from developing Alzheimer's disease. Not only risk factors, but there are few genes which plays an important role in the development of Alzheimer's disease, which include amyloid precursor protein, presenilin 1 and presenilin 2. The patients suffering from Alzheimer's disease experience the following clinical features, especially in the initial stages. Patient will be experiencing an episodic memory impairment, following which in the mild stage the patient will be having an immediate recent memory impairment as well as loss of interest, and as the disease progresses the patient will be having aphasia and executive dysfunction. In the severe stage the patient will be having agitation, sleep disturbance, and apart from all this the other clinical features includes patient will be having apraxias as well as the factual memory impairment. The diagnostic tools which will be helpful in diagnosing Alzheimer's disease include the CSF biomarkers, which are the reduced A-beta-42 levels and increased phosphorylated tau protein levels. Apart from the CSF biomarkers, we also have the other neuroimaging biomarkers which will be helpful in knowing the medial temporal lobe atrophy as well as reduced hippocampal lobe volume and entorhinal cortex dilatation with the help of the MRI brain as well as the FTG PET and SPECT as well as the task-free MRI diagnostic methods. Coming to the management of Alzheimer's disease patients, it includes two types of methods, which are non-pharmacological as well as pharmacological methods. The non-pharmacological methods include increased daytime daily activities, reduced daytime sleepiness, reduced noise before going to sleep, and maximum amount of daylight exposure, and avoiding the risk factors as well as good amount of diet as well as exercise, especially the diet which includes ketogenic diet, which has increased amount of saturated as well as transsaturated fatty acids. The other non-pharmacological methods for treating Alzheimer's disease patient include aroma as well as music therapy also plays an important role, as well as avoiding driving, which will be helpful as a safety measure with the patients having MMSE score of less than or equal to 24 points. The other pharmacological methods which will be helpful in treating the patient with Alzheimer's disease include two types of drugs like acetylcholinesterase inhibitors. The examples are donepezil, rivastigmine and galantamine, and the other group of drugs like NMDA receptor antagonists like memantine, which will be helpful in moderate to severe types of Alzheimer's disease patients. Apart from these, high dose of vitamin E, that is about 2000 international units per day, and selegiline also plays an important role in preventing the progression of moderate Alzheimer's disease to severe Alzheimer's disease. Apart from these, in postmenopausal women, especially with the help of estrogen replacement therapy, they will be less prone for the development of Alzheimer's disease in the further years. So here we are with the world theme for the year 2022 regarding Alzheimer's disease is the power of knowledge. So let us all know about the Alzheimer's disease, which will be helpful in treating and curing the society from the effects of Alzheimer's disease. Thank you.